CAR-T therapy is a promising new immunotherapy to treat refractory and relapsed malignancies such as non-Hodgkin lymphomas. The off-side effects of cancer immunotherapies may affect the kidneys. Therefore, identifying risk factors for acute kidney injury among CAR-T patients could enable preemptive management to help to reduce the incidence of AKI and its subsequent outcomes. Acute kidney injury is not uncommon. It can occur in up to 17% of these patients undergoing CAR-T therapy. But the good thing is that the patients have a mild acute kidney injury, and most of these patients recover by the end of the 1 month.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.